National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Dr. Jonathan Beatty, naturopath and a health expert here at nationalnutrition.ca. Today we're going to talk about skin infections and things you can do to help minimize your chances of developing them and different ways you can approach their treatment. So there's different types of skin infections that you can get, and it's very important that you work with your healthcare practitioner to ensure they get diagnosed accurately, because there are certain types of skin infections that can be very severe and can be very dangerous if they're not treated aggressively and quickly. So the two major ones that you're going to consider there is the classic, what we call flesh-eating disease. It can onset very benign looking, but can quickly progress into a very, very severe condition. Anytime you have any type of skin infection, it's best to get it diagnosed early so that you're not accidentally trying to treat a very severe infection and allowing it to actually progress to a point where it's going to be a lot harder to treat. The other type of infection you're going to want to make sure you don't have is what we call MRSA, or methicillin-resistant Staph aureus. What this is it's a type of skin infection that is resistant to most antibiotics. Now, that being said, there are some really fantastic little things out there that can help with the treatment of MRSA. And in fact, some research has uncovered a formula from actually, I think it was 1100 AD, and it was called Bards Bomb. And it's essentially a cooked down garlic and leek and red wine and honey extract. And that's boiled down, it's allowed to distill, and then that's taken orally and applied to the skin. And that seems to have some pretty dramatic impact on killing MRSA. So where the modern pharmaceuticals are failing, the bacteria still seems to be sensitive to some of the classic tricks in the doctor's toolbox, which is essentially garlic, onions, honey, and red wine to help kill this infection. So it's best to, again, work with your doctor if you have MRSA, but they may not be aware of this Bards Bomb, and it's actually been clinically studied and shown to be able to eliminate the MRSA infection. So something to consider if you do have that. Now, other types of skin infection you may see, bacterial infections that aren't the MRSA or the flesh-eating disease. These ones you have a little bit of a better chance of tackling yourself. The most common one is Impetigo or Impetigo, which has a honey-crusted lesion. So typically it's like skin sores that have this honey lesion on the outside. Very, very common in young children. They tend to have a little bit of a more suppressed immune system, less capable of fighting off that infection. And it can actually be well treated. Again, sometimes antibiotics are needed, but oftentimes poultices of herbs like golden seal, which are naturally antibiotic, can be very helpful. Certain types of raw honey, especially Manuka honey, has a very strong antibiotic effect. Colloidal silver can also work topically, as can tea tree oil or oregano oil. So all of these things may help you to treat an impetigo infection. On the flip side, other skin infections can actually be fungal in nature, in which case you're going to want to target something like grapefruit seed extract. Again, colloidal silver, oregano oil are all effective antifungals, and those things can help with fungal infections that might present as jock itch or athlete's foot or something along those lines. And then last but not least, the other type of major skin infection you might see are verruca, or what we commonly call warts. Now, again, warts can be transmitted through touch. There's a number of different ways that you can be exposed to them. So again, one of the things you're going to want to do if you do have a lot of warts is create kind of a barrier to try and prevent transmission of them. Some warts are more transmissible than others, but there are a few things that you could look at to try and treat them. Garlic, going back to garlic, that can be an effective topical treatment for warts. Just be careful not to leave it on the wart too long, as some of the sulfur compounds in garlic can burn the skin. Other things that you can try is actually the white internal part of a banana peel. It's one of those sort of, old ancient treatments for warts, but can actually be quite effective. There's certain compounds in banana peels that are actually anti-verruca. And then You can also try extracts of cedar or Thuja occidentalis, as it contains a chemical called thuone, which can actually help with the management of warts. So those are some of the things that you can do to help treat different types of skin infections you may have. If you like this video, please share with anyone who you think might find it interesting. You can always subscribe to our channel so you can always check out more of our informative videos here. Any questions or comments, please feel free to post them below. And last but not least, always remember, knowledge is health.